Good morning from Spain, and thank you very much for inviting me to this Congress. I was going to speak about HIFU in patients with uterine disease, but as my colleague Dr. Selva has already made a fantastic explanation about adenomyosis, I will focus on the HIFU treatment of uterine fibroids, okay? The first thing is, uterine fibroids are very prevalent and cause significant morbidity in women, dysmenorrhea, hypermenorrhea, etc., etc. And on the other hand, there is enough evidence about their negative impact on fertility, okay? More exactly, uterine fibroids as an independent factor can impair fertility, being the sole cause of infertility in 1 to 3% of women and causing 7% of recurrent miscarriage. In addition to surgical treatment, we currently have other minimally invasive treatment for our patients. Occlusive procedures and non-surgical ablative procedures such as radiofrequency and of course ultrasound guide HIFU. In my opinion, we should have knowledge of all of and discuss with the patient which is the best option for her, depending on the objective she wants to achieve. Does she want to improve her symptoms? Or does she want to achieve a safe pregnancy? Or is she asymptomatic and want to avoid growth of fibroid? This is the questions we are always think about. Yeah. Well, for the reasons that I will argue in my talk, I'm convinced that HIFU is the best treatment option for women who want to preserve the uterus to achieve pregnancy. Well, from the presentation that preceded me, everyone already know what HIFU is and how it works. So I won't spend too much time on these aspects. Only this short video on the right. The clip is playing in fast motion. You can see that we make an ultrasound pre-scan from the sagittal V in different sections with 5 mm separation. We start to treat the deepest area. You can see here the deepest area of the fibroid, applying 1 to 3 second energy exposures separated by 2 to 4 seconds between the shots. Okay, and you can see here the deepest area is very white. This is necrosis. Okay, and finally the decision to stop the treatment is made according to the intraoperative grayscale sonographic changes. You can see here at the final of treatment, the whole fibroid with hyperergogenic changes, indicating a complete ablation of the fibroid. The effect is very similar to that produced by magnifying glass when it concentrates the sun's rays. Okay, therefore, HIFU produces ultrasound waves that pass through the skin and adjacent tissues and are focalized to necrose a deep localized tumor, okay? In this technique, the focal spot, as you know, is guided by real-time ultrasound imaging. HIFU, its efficacy and its safety and efficacy is supported by several studies of pathological anatomy that demonstrate a coagulative necrosis with clear, sharp boundary between death and life. As I said before, the hyperechogenic changes are very important to evaluate the efficacy of the treatment. But another way to evaluate this efficacy is by contrast-enhanced ultrasound during treatment or contrast-enhanced MRI after treatment. In both cases, you can see a non-perfused volume, in this case, of 100%. Here, with contrast-enhanced ultrasound, and here after HIFU in MRI. Well, and this is our 14-year experience. We have treated a total of 862 patients, and okay, only in 52 patients the treatment was not achieved due to different problems such as pain, intestinal gas, air in the bladder, okay, and poor visualization due to obesity and other factors. Among the treatments completed here, 68% were successful, okay, and 32% require surgical procedure, hysterectomy or myomectomy. Of all these factors, the most relevant is the type of fibroid. This is Funak's classification, you know, fibroid type 1, 2 or 3, depending on T2 MRI signal intensity, comparing with the skeletal muscle and the myometrium. Type 1 and type 2 fibroids are hypointense or isointense and have a good response to HIFU. On the contrary, type 3 fibroids are hyperintense and the response is much worse, okay? This is very, very, very important. The other factor to consider is the rate of vascularization. You can see the different response between high vascularization fibroids at the top here, okay? Look at the small non-perfused volume here, very poor response, and the difference with the other case, okay? A woman with lower medium or medium vascularization fibroids, okay, with a large non-perfused volume in both cases, okay. This differentiation is a constant in all publications and also in our experience. Okay, after 12 months, the mean volume shrinkage of the fibroids was 50%, reaching 67. The complication rate was only 7.5%, mainly first and second degree skin burns that did not leave sequels, okay? And only 2 patients had a major complication, which was third grade skin burn. And there were other minimal complications with no consequences. It should be noted that there were no cases of bladder or bowel perforation, and no patients developed amenorrhea after HIFU treatment. Therefore, 7% of minor complications and 0.4 of major complications, okay? We are lower those of standard surgical procedures and other minimal invasive techniques such as uterine artery embolization. Another advantage of HIFU over these other procedures is that HIFU is always an outpatient procedure, an outpatient treatment, okay? In relation to fertility, HIFU slowly and effectively achieves ablation of uterine fibroids without damaging the surrounding myometrium. HIFU also preserves ovarian and endometrial function, and we have some studies that show no significant difference between the anti-Mullerian hormonal levels before and after treatment. In this other prospective study from 2020, Melkozerova et al. Observed no significant changes in molecular and tissue markers of endometrial receptivity in women undergoing HIFU ablation for uterine fibroids. What are the goals of HIFU for fertile women? How can HIFU help? For me, this is the most important slide of my presentation, the most important. Fortunately, HIFU achieves it immediately thanks to the complete ablation of the fibroid here, okay? And of course, the second goal of HIFU in women with gestational desire is to shrink the fibroids in order to normalize the uterine anatomy. Logically, this second object and our experience is not so much different from all these publications. In our retrospective study, we include 560 women with symptomatic uterine fibroids who underwent ultrasound guide HIFU between 2008 and 2018. In our series, we must highlight that 33 of women who became pregnant after HIFU treatment had a previous history of primary or secondary infertility, and 18 patients had at least one miscarriage. It is reasonable to think that HIFU could help to improve fertility in this type of patients, okay? Between 2008 and 2018, 71 pregnancies of 55 patients have been obtained, which is, to our knowledge, the longest series of pregnancy after HIFU treatment in a Western country. The pregnancy rate was 34%, okay, which is not bad if we compare it with other treatments. Among the 71 pregnancies, there were 43 successful deliveries, okay, which was, 46 deliveries, including a natural twin gestation, with an incidence of cesarean section of 43%, which was much lower than in patients undergoing myomectomy or uterine artery embolization, or in those reported by other authors after HIFU. Okay, as you can see in this slide, the rate of preterm delivery was 9%, only 4 cases, which is lower than in series of pregnancies with untreated fibroids or pregnancies following uterine artery embolization. The mean birth weight of the 44 newborns was 3 kilograms. 7 of them were low birth weight infants, these that you see here, okay? And except for the 1.4 kilogram baby who was born with a previously diagnosed tetralogy of Fallot and uterine artery and intrauterine growth restriction, the remaining newborns, 98%, developed well without complications during postpartum and breastfeeding. Okay, these are the few complications detected during pregnancy. 1 preterm labor, 2 cases of placenta previa, and 2 cases of preterm premature rupture of membranes, okay? And the complications during the delivery, okay? Only 2 cases of emergency cesarean section for common problems, fetal bradycardia in 1 case, and for hemorrhage associated with placenta previa. 3 cases of retained placenta with manual removal, and 1 case of severe preeclampsia, okay? It should be noted that our series had no cases of uterine rupture or placenta accreta, which can occur after myomectomy or uterine artery embolization. And this is another patient with a transmural fibroid successfully treated, with HIFU, and with hysteroscopic resection of the remaining myoma fragment here, 2 centimeters fragment, which was resected by hysteroscopic 6 months later, okay? And this woman became pregnant spontaneously 3 months after this hysteroscopy, okay? Hysteroscopy, sorry. And of course, we treated difficult cases as this patient, cases of polymyomatosis with fibroids of different locations in the same patient. The submucosal fibroid that you see here, this one, okay, disappeared completely 8 months after HIFU. Just at that moment, the patient underwent a successfully in vitro fertilization and got a full-term pregnancy. And okay, so much cases. Another case with 2 big fibroids treated completely. And okay, and bulky fibroids, of course. We have treated some patients with a very big bulky fibroid with successful. Okay, take-home messages, okay. Ultrasound guide HIFU therapy is an effective and safe treatment for uterine fibroids, which with a much lower complication rate than myomectomy. Ultrasound guide HIFU makes it possible to obtain full-term pregnancies with few intrapartum or postpartum complications in patients with uterine fibroids. Moreover, due to its non-invasive nature, HIFU seems to be the first therapeutic option in women with uterine fibroids and gestational desire, with many advantages over myomectomy and uterine artery embolization, of course. And in some cases, HIFU could even improve the fertility of patients with a history of primary or secondary infertility, okay? And of course, even though we have more and more studies in this line, we need more prospective and randomized studies to confirm all these observations. Thank you very much. I want to show the last slide that for me is very important. This one, this is a history. Okay, this gentleman was called Archimedes. This one you can see here, and he was a physicist, engineer, inventor, astronomer, and mathematician from ancient Greece. Okay, 3rd century before Christ. Okay, very ancient history. He created a system of concave mirrors that reflected sunlight by concentrating it on enemy ships. You can see here during the battle of Syracuse, against the Romans in order to set them on fire. Therefore, and as you can see represented in this painting, the concentration of and focus of energy in order to destroy is many years old. Its medical application has come to us with the ultrasound guide HIFU technique. Let's not let time pass. Let's take advantage of it, is my message.